Hi, I'm Pam Taub. I'm a cardiologist at UC San Diego and associate professor of medicine at UC San Diego School of Medicine, as well as director of the Cardiac Rehab and Wellness Center at UC San Diego. Today I'm going to be giving you some highlights from the Women's Health Summit that was held at the Cardiometabolic Health Congress in Boston. One of the things that we focused on in this Congress is the impact of conditions that are very unique to women, such as pregnancy, menopause, and how it impacts cardiometabolic health. I'm particularly interested in how conditions that occur during pregnancy can have long-term impact on cardiometabolic health. I think that women's health is important for all providers that take care of patients, because 80% of women have a pregnancy in their lifetime, at least one. And so it's very relevant in taking care of these women that we understand the conditions that happen during pregnancy and how they impact long-term cardiovascular health. For instance, women who have gestational diabetes have a much higher incidence of developing type 2 diabetes later in life. So if you compare women who don't have gestational diabetes, they have a 2% risk of getting diabetes later in life. However, if you have gestational diabetes, you have about a 19% risk of developing gestational diabetes at a 9-year follow-up time point. So much higher risk. And one of the things that happens is we often come into contact with women in their 50s or 60s. And at that time, pregnancy is such a remote event for them that it's not even on their radar in terms of a potential health issue that needs to be addressed with their provider. But it's important to educate women that things that occurred in their pregnancy, such as gestational diabetes, have a long-term impact on cardiometabolic health. And one of the goals of our Women's Summit was to raise awareness among providers about these conditions so that they can ask women when they're getting a history about some of these conditions. And the reason it's important to do that is because it really changes your management. So for instance, you have a woman that has gestational diabetes. Well, she needs to be screened every 3 years for type 2 diabetes. And if her numbers come back slightly elevated, such as a hemoglobin A1C that is in a borderline range for developing type 2 diabetes, it's important to really be aggressive about lifestyle management strategies and pharmacologic strategies. So recognizing the impact of pregnancy-related conditions on long-term health is very important. One of the other topics that we discussed at the Women's Summit is polycystic ovarian syndrome, and that's associated with insulin resistance. And that's an important syndrome to think about when a woman gets pregnant, because these women with polycystic ovarian syndrome often get gestational diabetes. About 10% of women with gestational diabetes have polycystic ovarian syndrome. So these are patients that we want to screen very early in their pregnancy for elevated blood sugars, because that also changes how we manage those mothers and also the fetus in terms of screening and close monitoring. Those were just two of the topics that we discussed at the Women's Summit. Other topics that we discussed were cardio-oncology, especially the impact of breast cancer treatment on long-term health. We also discussed polycystic ovarian syndrome, hormone replacement therapy, and contraception on women's health. We discussed ways to personalize treatment based on a woman's atherosclerotic cardiovascular risk profile. These are all very important conditions to be aware of that can impact a woman throughout their lifespan.